Hello, this is Giuliana Nava once again, and I'm here today to talk to you about the topic of delegation. When we are in nursing school, we're exposed to delegation in class. We talk about it, we debate about it, we grasp the concept. However, we never really have the chance of applying it. If you don't have any practice undergrad, it becomes a struggle when you are a new nurse. It's important to remember when you become a new graduate nurse that you won't be able to do everything that you wish you could for your patient. You're not going to be able to feed, toilet, change everybody at all times. So, mastering delegation is a must. I work nights and I have 6 to 8 patients a night. So, as you can see, on top of all your responsibilities of passing medications, assessing patients, documenting everything, calling doctors, you won't be able to get around to all the smaller tasks. So, having the assistant personnel in your staff is a great help. Before you actually delegate, you review their job description so you can see what they can and cannot do. Before you delegate, it's always important to remember say please and thank you. Those two words will get you very far. Be appreciative of your staff and everything they can do it for you because they are a great addition, and at the end of the day we're all there to do the same thing. We want to improve patient care. When you delegate the right task to the right person at the right time, it's also important to follow up on that task because even though you delegated, it means that you were accountable for it. So if the task didn't get done or it didn't get done the correct way, you are still responsible for the outcome. So for example, you ask, "Hey John, who's one of the assistant personnel on the floor," you say, "Could you check on 351A on Mrs. Smith? I noticed that I went in there. She had a wet brief, but I got pulled out of the room because I had to attend to an emergency, and I won't have the time to get around to that." And he would say yes or no, depending on how the flow of the floor is. It's important to find out if you are feeling resistance from your personnel, and if you do, address it right away so you can have a good work environment. If the issue is addressed and you're still not finding a resolution, you have to learn your chain of command so the issue can be addressed. Talk to your preceptor, talk to the nurses around you, see if this is a common problem, and then bring it up to management. So hopefully the three of you can sit down and discuss the issue, or maybe your manager can sit down with that person and find out what's going on that's bothering them or that caused them to feel resistance towards you. It's very important to know that at the end of the day, like I said before, we're all working together to provide the best patient care that we can. So the only way around that we can do it is working as a team. I hope this video was helpful to you, and I'll see you on the next video.